The intervention of solar health is part of a UNDP global initiative known as the Solar for Health Initiative that aligns UNDP's role in identifying and testing innovative financing instruments and integrated solutions to achieve development targets linked to SDG 7. You will recall that SDG 7 speaks to ensuring access to affordable, reliable, sustainable, and modern energy for all.
We have numerous challenges. Patients being treated in the dark, our pregnant women being seen in the dark, unable to deliver on a light, surgical procedure being stopped at night because there was no light, the darkness that engulfed the entire hospital before the arrival of the solar panel that was installed by the UNDP.
To the MCH, where we used to be conducting delivery at a time when the machine go off, at which time we were using generator, and sometimes there will be no fuel, and you receive a labor case, you're forced to do the delivery. We used to be forced to use flashlight or phone light to conduct the delivery, which of course it really used to be embarrassing to us. And also our lab was not functional because at time when there's no gasoline or the generator is down, there could be no proper lab used to be done.
And we also have our DHG office that is on a clinic compound. They got some equipment that includes the photocopier machine, the printer, that's supposed to be used for the facility in the entire district. But because there was no current on the compound, those materials were just kept and they were not using it.
The solar electrification of 12 rural health facilities has undoubtedly improved health service delivery at the 12 health centers, which serve over 200,000 people across the 7 counties in Liberia, namely Cape Mount, Grand Bassa, Bong County, Bapolu County, Montserrado, Lofa, and Bomi counties.
Since the UNDP installed the solar panel at the Liberian Government Hospital, we have had a great benefit that include the lab at night. We have had light in the ER that our patients can be seen at any hour. We've been able to do surgery in the OR, which is the operating theater, and we have the OB that we can have delivery at night at any hour.
We have been working, our maternal ward have been brighter, our compound, our lab have been functional. We now use our microscope, our HB machine, all are in use for now. So those were the really huge relief that UNDP brought to us through the installation of the solar panel.
The Solar for Health project started in 2019 as a pilot, benefited 12 rural health facilities, including a few urban health centers recommended by the Ministry of Health. The 12 health facilities that benefited from the pilot Solar for Health project include the Duporo Health Center here in Montserrado County. In Grand Cape Mount County, 2 health facilities benefited, including the St. Timothy Hospital. There, because of the size, we could not cover the entire hospital, but we intervened in 3 critical areas: the operating theater, the laboratory, and the maternal-child health center. We did similar in the St. J Hospital, also in Grand Cape Mount, only in the 3 critical centers. Stay in the west, in Bomi, the project intervened at the only government hospital there in Topmaba, the Topmaba Government Hospital. And in Bapolu, we intervened at the Gokala Clinic. And then in Grand Bassa, the project intervened at the government hospital in Bikiana, while in Bon County, we intervened at 2 health centers, including the Palala Health Center, just on the main road, on the Bangraganta Highway, and then the Zibe Clinic off the road to Ganta. In Lofa County, we intervened at 4 health facilities, including the Konya Health Center, the Telewayan Memorial Hospital in Vonjama, the Kolahun Hospital in Kolahun, and the Vahun Health Center. In Kolahun and Telewayan, as I mentioned earlier, because of the sizes of the hospital, we intervene in the 3 critical areas. At all of these centers, health services have significantly improved. Instances where hospitals were spending money, they are now saving this money for other very important activities. We learned a lesson during the implementation of this project, and this lesson and the experience gained is now helping us to develop a bigger Solar for Health project, now targeting the Green Climate Fund. We want to thank the government of Liberia for submitting an expression of interest to join 5 other sub-Saharan African countries to develop this proposal for submission to the Green Climate Fund. If approved, this project will intervene in 464 rural health facilities. So we hope that we will work with the government to develop this proposal for upscaling this project.
It has reduced CO2 emissions because all the health centers prior to the introduction of the Solar for Health initiative were using fuel oil to power their generators. The total cost of the project so far has been $1.3 million. The project has brought relief to people requiring health services in rural communities, including pregnant women, who in many instances gave birth under very poor lighting conditions, posing a danger to their health and the health of the infants. During the site assessment mission in 2019, the administrator of the Telewayan Hospital in Lofa County reported that in some cases, the families of patients diagnosed for operations were requested to provide fuel to power the generators. Now, this, thanks to the Solar for Health initiative, is no longer happening. UNDP believes firmly that renewable energy is vital for sustainable development. In this regard, we encourage investment in renewable energy as part of efforts aimed at greening the environment, fighting climate change in Liberia, and most importantly, ensuring energy access that is modern and that is environmentally friendly for all.